Thank you very much. Our next question is, what are the current estimates for COVID mortality rates? Could it be that we've overestimated the deadliness of COVID since there are people with no to mild symptoms who were never tested? Additionally, I heard that some people with underlying conditions such as heart disease die with COVID-19 and then are counted as having passed away due to COVID, rather than these underlying conditions. Could this counting method inflate our estimation of mortality rate?
So the honest answer to this is that nobody really knows how many people are really infected. And that's just because we're not testing everyone. The only way to get the actual number is if we did test every single person, regardless of what symptoms they had, where they are, and yeah, just everyone gets tested. There have been some small studies looking at this, like for example, they've taken like maybe a small town in Germany or in Italy, and they've tested everyone in that town. That's the only way to get a sense of how far it's spread in a community. But of course, we can't extrapolate from that data to the entire world or to the US. So we don't really know, and because of that, there's just a wide number of estimates out there as to how many people are infected. Again, there's different data on how many people are asymptomatic, to anywhere from like 20% of people infected being asymptomatic up to 50 or 60% people are asymptomatic. So if we're not testing everyone, we'll never actually know the true answer. There's an interesting study recently that showed in New York City, from doing antibody studies, maybe around 20% of them had COVID. And so, if you have a population of 8 million in New York and they have less than 200,000 cases, that's over 40 times the actual diagnosed rate. Now, there's also problems with that study too, and we don't know exact numbers, but a lot of people are estimating that the actual number in the US might be 10 or maybe 20 times higher than what we have right now. In terms of the fatality rate, that's the same problem. So again, if you don't know what your true numbers are, you'll never know what your actual fatality rate is. Right now, from the numbers that we do see, that we have counted, it's around 5%. If you're testing more people, for example, in South Korea, the fatality rate will be lower just because you're testing people maybe with milder symptoms or who don't have any symptoms. So for Korea, it's maybe around 2%. But then if you get into a situation like Italy, where they have overwhelmed hospitals, they're not able to take care of the patients that they have, then that's when you're going to get a higher fatality rate. And theirs is closer to 15% right now. That's the situation that we don't want to have, because we don't want to overwhelm our hospitals. In terms of how you count a death as being related to COVID, the way we do it here is that if you have COVID, even if you have an underlying problem like COPD, a lung disease, or heart problems, a previous heart attack that you've had, and you're not healthy at baseline, what COVID does is that COVID just makes you sicker in general. So COVID can cause heart attacks to come up, even in people that actually don't have a previous history of that. And so because COVID is worse, we count it as a COVID death. There are also situations where deaths occur but that are not attributed to COVID. So maybe someone has a pneumonia, but they never got tested for COVID. Those deaths would be considered just pneumonia and not attributed to COVID. So the death count could actually be higher. And some people die at home and are not tested. So again, there's a lot of questions about what the actual death count is, but I think it might be higher than what it is.